team. أنا دكتور تامر El-Baz, Professor of Endemic Hepatology and Gastroenterology. It's my pleasure today to be with you. I am talking about capsule endoscopy, and I will share with you some techniques and some tools about capsule endoscopy. First, I would like to start with the introduction that we have 5 capsule endoscopes that are present worldwide. The first one is the given diagnostic system that started in 2000, that's a PILCAM capsule, followed by Olympus capsule, that was the endo capsule in 2005. Then it was followed by the Mirocam capsule from Korea, capsule from China, and the Capsule Cam from United States of America. Generally, all of the capsules, you can notice that they are the size of just a pill. We have 4 systems that look similar, while 1 system that look different. The 4 systems that of PILCAM, Mirocam, Olympus, and the capsule, you can notice that there is a dome, a transparent dome, cameras are lies beneath it, and a radio transmitter to transmit the images to a data recorder, and they are front viewing, so they give pictures similar to the endoscopes, ordinary endoscopes. In the Capsule Cam capsule, you can notice that the camera is present at the side. It's a side viewing capsule, and it takes pictures 360 degrees. There are different editions of capsules. There are the small bowel capsules, there is the esophageal capsule, and the colon capsule with cameras that are present on both sides, and the Mirocam small bowel capsule also with camera from both sides, so we can gain pictures taking the 360 degrees. Generally, there is no difference between the different capsule system as regard the dimensions and the weight. The difference is slightly in the field of view. They are ranging between 140 to 170 with the Capsule Cam 360 due to the lateral vision. Frames per second, they are taking images from 2 to 6 images per second, and the battery life is between 10 and 15 hours. For every system, in the 4 systems, PILCAM, Capsule Cam, and Mirocam, there is a capsule. There are the wires that are attached to the abdomen. These wires are attached to a data recorder or transmitter. It can be blunt like this one, or it can be with a real life viewer, so I can see the images of the capsule at the same time the patient is swallowing it. Then we have the software. The 4 systems have the picture that looks like that of the endoscope. You can move it forward or backward. You can take pictures. You can put landmarks. And the picture of the Capsule Cam, as I said, that's 360 degrees. But this type also, it's perfect to visualize the 360 degrees, the whole small bowel human. But you have to be acquainted and to be trained for that type of images. Indications for capsule endoscopy, the main indication for capsule is obscure GI bleeding, followed by suspected Crohn's disease, patients with suspected small intestinal tumors and polyposis syndromes, of course, chronic diarrhea, patients with celiac disease, either they are suspected or refractory for possibility of complications such as lymphoma, and the evaluation of side effects of NSAIDs. Less common indications is unexplained chronic abdominal pain, diffuse intestinal disorders, esophageal diseases by the esophageal capsule, and the screening for colorectal cancer, and it has some points and guidelines for using capsule endoscopy for screening of CRC. Limitations, of course, capsule endoscopy, lack of therapeutic capabilities. It's diagnostic, purely diagnostic. You cannot even take a biopsy. Inability to control its movement through the GI tract, and difficulty in localizing the lesion. I can mention that the lesion is present in the proximal, mid, or late jejunal or ileal region, but I cannot determine that it's, for example, 50 centimeters from pylorus, for example. I brought a case as an example for a male patient, 52 years old, with obscure overt bleeding and recurrent melena. His upper endoscopy and the colonoscopy were not conclusive for a source of bleeding. So he performed a capsule endoscopy. You can notice that the lesion was 3 hours after of ingestion of the capsule, and that lesion was present at the late jejunal, early ileal region. From the pictures, you can notice that the villi are abnormal. It's a mass causing structure and narrowing, spontaneous bleeding. It was a cause of obscure GI bleeding. And that mass looks firm, as you have seen, and this capsule guided for the patient to perform intraoperative resection. He performed a resection for that lesion that proved to be adenocarcinoma. It was out of reach of upper endoscope and colonoscope. It was within the mid of the small bowel, and the capsule endoscopy helped for its diagnosis. And thank you very much.